There you go.
Yes, there you are.
Hi, good evening. Um, about 4 months ago, I don't know what happened. I was under a lot of stress. There is history of hypothyroidism,
Okay.
and all of a sudden, I could not walk properly. I think it was really, a lot of it was GI issue, which caused increases
Like
in
you had a hard time like walking in a straight line, or you had a hard
couldn't
time
stand
moving your
up,
legs?
couldn't
Couldn't
stand up.
stand up.
If I stood up, I felt weak, or if I put my hands up, all of a sudden I felt like I wanted to pass out.
Did you ever
And
have your blood pressure checked?
and then of course upon doing standing,
Did you ever have your blood pressure checked?
yes, it would just increase.
The blood pressure would go
Anxiety,
up, not
yeah, it
down.
would just go up. Yeah. And so this has been going on for like about 4 months. It's been, I am an historian too. And so I've been getting a lot of prayer and so forth. But I've been placed on a number of BP meds that has made me profusely weak. Anxiety still is there, and so forth. And so I'm just trying to figure out. I've been putting on like Solfugio music to kind of help with the chakras and everything, and trying to find the right med to be on, or just to get off of it,
Sure,
because now
sure,
I've
sure, sure.
lost over um, 25 pounds.
What what
And
what kind of blood pressure medicine are they putting you on?
beta blockers
Beta blockers.
and alpha blockers.
Mm, mm.
And I'm having an increase in gastrin. And so I don't know, maybe the food isn't being absorbed properly because now the weight is just dropping.
That's probably the thyroid issue. Um, how off is your thyroid? Is it like significantly or just
Well, we've
slightly?
done testing, and in regards to the levels and being on the meds that I'm on, it's right where it's right where it needs to be.
Okay.
But when I increased it, I had night sweats. Um, and so what I did is I adjusted it myself, and
Mm-hmm.
so I no longer have that, but the weight just keeps, and no one can explain it as to why the weight is dropping, and also why the BP is doing what it does upon walking and standing.
And has there been any like I'm just curious. Has there been any kind of sort of significant trauma over the last couple of years or anything like that?
I
Or do
will
you have a
say over during these that around that time I took a new job that was just horrible. In addition to that, I was going to court a lot, fighting my child's dad for just child support. He's a minister, and I think he dabbles in a little bit of the spiritual side
Mhm.
and so forth. And but I
Sounds
was
like
just
he dabbles
driving.
a little bit in also being a little bit of a jerk.
I say the spiritual side. I when I say spiritual
But
side,
like,
I
is he
think,
like really aggressive and like kind of a jerk towards you? Like really?
oh, absolutely.
Yeah, okay.
And
I was kind
but
of
I
making a
think,
joke, but it was like not really a joke. Like I think
yeah,
actually a
but I
big
think he
thing.
dabbles more like in trying to get back on the spiritual aspect of things. But it was that, and just and all of a sudden I was driving to court, and it's something, I don't know what happened. All of a sudden I just had extreme anxiety,
Okay.
and
So like normally I would look at this like from a point of view of like physiology or maybe something psychology, but I think like you said, let's look at it from the point of view of energetics. And you guys have a child together and you were partners for a little bit. So there's a thing like that looks like an umbilical cord that goes back and forth between you, with him, especially since you have a child. And sometimes they're negative, but there's always kind of positive ones there. those positive ones look super, super, super contaminated. And when they're really, really, really bad, it could cause some of the symptoms that you're talking about. I'm not saying that that's exactly what it is, but
Mm-hmm.
everything that you're saying, and even like kind of like how I hear your like voice and everything, you just sound like beat up. You know what I mean?
Yeah.
You
And
just
I look
sound
and
like,
that's not me,
yeah, like you just sound like you're just like worked and you're like, I just need to sleep this off for a month and then, whatever. And so you have a couple of choices here that can help kind of clean this up. Um, uh, so there's a blend called the etheric chords, or you can use ironbark eucalyptus. And then I would choose one of those. And then the other thing is I would augment that. I would use those first, and then there's a blend called chakral root cleanser. Like just whichever one you're using, at their cords or ironbark eucalyptus, like inhale it for a while. And at first it's going to feel good, but after a while, start thinking of him as you inhale it, just because it will really clean the cords between you guys. And then the chakra root cleanser will just kind of flush out some of the contamination, which is like his emotions and hostility and aggression. And it will flush some of that out of your system. And let's have you do that for a little bit and then see where you're at after doing that for several days or like up to a week. And then we can kind of start fine tuning like how to treat the other symptoms. But in really extreme cases, and like I think like a big indicator was like you're on the way to court and then it got worse. Like that reinforced what I was already thinking.
Yeah.
The timing of that is not a coincidence.
I don't think so. He ended up winning because like I said, I was so sick, couldn't get out
Yeah.
of bed. And but nevertheless, how do I get these items? Like
We'll post them on
We have them in the chat, and I can also email you the links so you can order them.
yeah, because I sent an email, Reverend Peg was so enthusiastic, was so happy about telling me about you guys. And I actually see you on the blessings and the prayers and stuff.
Oh,
I
nice.
join.
Yeah.
Yeah, and I've never met you before. I've met some old ones that were there years ago that I
Uh-huh.
don't see, like Jenny.
Uh-huh.
She's no longer there, and a few others. So it's really nice to meet you.
Nice to meet you
Um,
too.
yeah, but yeah, I gotta figure this out because this
Yeah,
is
let's get you feeling better.
yeah. So alright, but I guess if you sent an email, because I emailed you guys yesterday when I spoke to Rev, and
Okay.
I sent an email and I got a response back, but I think it was too late for me to respond back.
Okay, good. So I have your email. Good, good.
Oh, I see the chat now here. Okay, so this is on your website?
Yes, those links that are posted go directly to the oils on our website.
Okay. All right, absolutely. Thank you so much.
Absolutely. And keep us posted.
Absolutely. Okay.